Studies have shown balanced hormones are necessary for good health and disease prevention for women and men as we age. Now, here to tell us about a treatment that helps both men and women regain their vitality is Dr. Amy Carter from the Kansas City Wellness Center. This is such a fascinating topic, and sadly, most of us don't talk about it enough. So you're going to give us a lot of good information and talk about a specific treatment. And is it pellet therapy? And what does that mean?
Correct. So we're here today to talk about pellet therapy. We like bioidentical hormones, and bioidentical hormones can come in different routes. But we have found great, consistent results using pellet therapy with bioidentical hormones.
So when your patients come in, what are the symptoms they're complaining about when you're like, we need to talk about balancing out your hormones?
So there are a lot of different symptoms. Decreased energy, excess fatigue, trouble sleeping. Some people get hot at night. They feel like their temperature's off. Some women have hot flashes and night sweats. Decreased intimacy with their partners, mental confusion, focus, decreased memory. Those are kind of the major ones.
So what kind of results are you seeing? Because those seem like some serious side effects that you want to address.
Yeah, so we see great results. I mean, there's some women that have, notice mild improvements, but most people, most men and women notice a significant improvement. They come in, they say they feel better, they're able to exercise better, because a lot of men and women have weight issues as well. And so they feel like they're too tired to exercise on a regular basis. So a lot of people notice energy, they notice more mental clarity, increased in their memory, they sleep better, and so they're able to function better on a regular basis.
Now, this is an age-related issue. When do people normally start seeing problems? At what age? And then when is it more common when you might need to come in and visit someone like yourself to address those problems?
So most women and men see declines in their 40s and 50s and 60s, but it can be as early as their late 20s or mid 30s.
Now, what happens when someone would come in and say they have some of those symptoms? Would they describe that to you and then you do blood work?
Correct. So sometimes people call and on the phone kind of describe what they're having. So we can do it two different ways. They can come in for an appointment and then we send them for labs, and then they can come back and have a discussion and do hormone therapy if they want, or so they can come in first, then get labs, or we can get labs first, and then they can come in and get the hormone therapy.
Now talk about how it works. It's pellet therapy, so this is something that is injected into your body through a small little incision every few months. So walk us through the process and how often we have to come see you.
Sure. So when you get the pellet therapy initially, it's just, we put a little numbing medicine under the skin, we make a small incision, and then the pellet's about the size of a grain of rice, and we inject that underneath the skin. People typically come back in about 6 weeks with repeat labs, and we assess their symptoms and how they're doing. Sometimes they get a repeat little boost at that time, and sometimes they don't. Most of the time they don't. And then women typically get repelleted every 3 to 4 months, and men are usually every 4 to 5 months typically.
And so you can take care of some of those symptoms, but there's also long-term effects. You're preventing diseases.
There are long-term benefits. So testosterone and estrogen increase bone mineral density in our bodies, and so women are at reduced risk of getting fractures and osteoporosis. We know that estrogen and testosterone are also neuroprotective, and so they help our brains, and so they decrease inflammation and increase blood flow in our brains, so there's theoretically less risk of dementia. And then it also, testosterone and estrogen reduce inflammation and increase blood flow to our hearts as well.